Physiowebseries Shoulder Complex Series 7. In previous series, that is series 6, we discussed about scapulohumeral muscles. In this series, series 7, we will study about spinohumeral muscle. It includes one muscle, Latissimus dorsi or Latissimus dorsi. So as the name suggests, spinohumeral, it connects the spine or the back region to the humerus. So let's see about lat dorsi. The origin and insertion of Latissimus dorsi. So it has origin from 1, 2, 3 and 4 parts. And one more, which is the fascia. So the origin is from the iliac crest, then from T7 to T12 vertebral spinous process, then third will be the lower 4 ribs, and the last will be the inferior angle of the scapula. So these are the points of origin of lat dorsi, and the insertion is from the floor of intertubercular sulcus of humerus. So we saw that the origin is from posterior 1/3 of outer lip of iliac crest, then from T7 to T12 spinous process, thoracic vertebra, lower 6 thoracic vertebra, T7 to T12, then the lower 4 ribs, and then the inferior angle of scapula. Other than this, from the posterior layer of lumbar fascia. In this diagram can be appreciated the posterior layer of lumbar fascia, and inserts to the floor of intertubercular sulcus of humerus. Over here also we can very well appreciate posterior part of the iliac crest, lumbar fascia, T7 to T12 spinous process, lower 4 ribs, and then the inferior angle of scapula, inserting to the floor of intertubercular sulcus of humerus. That is our Latissimus dorsi origin as well as insertion. Having nerve supply as thoracodorsal nerve root C6 to C8. So thoracodorsal nerve or nerve to Latissimus dorsi will supply or innervate this muscle. That was about the origin, insertion as well as the nerve supply. So to remember the origin, just start from below and reach upwards, and this way the muscle fibers will insert over here to the intertubercular sulcus of humerus. So from down to up for insertion, you can start from iliac crest, then T7 to T12 spinous process, lower 4 ribs, and then over here inferior angle of scapula. Let's continue with the action of Latissimus dorsi. So as it has its attachment to the shoulder or the humerus, it will perform shoulder movement as shoulder adduction, then medial rotation as well as extension. So we know the origin and insertion. So from back to front, this way the muscle is attaching. From back to front. So it is basically twisting to insert to the intertubercular sulcus of humerus. So as it comes from the back to attach to the front of the body at the humerus, it will help in adduction, extension as well as medial rotation of the humerus or the shoulder. Other than this, as we know, it passes through the inferior angle of scapula. So it helps to hold the inferior angle of scapula in place. Other than this, it assists in expiratory effort, violent expiratory effort, as it is attaching to lower 4 ribs, as well as T7 to T12 spinous process. So it helps in violent expiratory effort, coughing or sneezing, for example. Apart from that, it is climbing muscle. Important thing to remember, latissimus dorsi is climbing muscle. So it helps in activities, other activities apart from this, such as swimming, rowing, climbing, pulling, folding arm behind back, and scratching the opposite scapula. So the muscle in action will be primarily latissimus dorsi in those activities. So that was about origin, insertion, nerve supply, and action of latissimus dorsi. Now let's discuss about the facts of latissimus dorsi. As we can appreciate in this picture, the latissimus dorsi has those oblique fibers, and these oblique fibers of latissimus dorsi will assist trapezius as well as the serratus anterior by controlling the scapular motion inferiorly and laterally. So as we know that latissimus dorsi crosses this inferior angle of scapula and inserts to the intertubercular sulcus, floor of intertubercular sulcus. So it has attachment over the inferior angle of scapula, that is over the scapula. So the oblique fibers will assist the other muscles attaching to scapula and acting over the scapula, which is trapezius as well as serratus anterior. Trapezius as well as serratus anterior. So those oblique fibers will help trapezius as well as serratus anterior by controlling the inferior as well as the lateral, the inferior as well as the lateral movement of scapula. So here latissimus dorsi assists trapezius and serratus anterior. Apart from this, there is one more thing, that the latissimus dorsi forms the part of posterior oblique sling, myofascial sling, which is the outer core system. We will see in detail about it. So what it does, it connects with the thoracolumbar fascia as well as opposite side gluteus maximus. So the latissimus dorsi connects with the thoracolumbar fascia as well as the opposite side gluteus maximus. Thoracolumbar fascia over here, and then the opposite side gluteus maximus, and here is the latissimus dorsi. So this forms an oblique, posterior oblique sling, can be traced somewhat like this. So this forms the posterior oblique sling, myofascial sling. So let's see in detail about that outer core myofascial sling system. The posterior oblique sling can be appreciated in this diagram, formed by latissimus dorsi, thoracolumbar fascia as well as opposite gluteus maximus. Can be appreciated well in this diagram. So latissimus dorsi, thoracolumbar fascia and opposite side gluteus maximus, this whole forms the posterior oblique sling. So latissimus dorsi is part of this posterior oblique sling or the outer core myofascial sling system. So these three form the outer core myofascial sling system. what do? They become the integral part of sacroiliac joint stability through force closure mechanisms. So these three structures, latissimus dorsi, thoracolumbar fascia, as well as the contralateral gluteus maximus, they play crucial role in sacroiliac or SI joint stability. That was about the myofascial sling system, the posterior oblique sling. Now, as we know that this is the posterior oblique sling, which has latissimus dorsi, thoracolumbar fascia and contralateral gluteus maximus. So what is the clinical role for them to play? So if the contralateral gluteus maximus becomes weak, can be appreciated in this diagram. If the contralateral gluteus maximus becomes weak, then the load will be over the latissimus dorsi. This part, this is the gluteus maximus, so opposite side latissimus dorsi. So this will have to take the load, as now the gluteus maximus is weak. So that means gluteus maximus is inhibited and the latissimus dorsi hence is overactive or hypertonic, as this forms a chain. And as we know that the latissimus dorsi attaches to inferior angle of scapula. It has its attachment over the inferior angle of scapula. Can be appreciated, the latissimus dorsi has its attachment over the inferior angle of scapula. So what it will do, the overactive latissimus dorsi will cause depression of scapula as well as its anterior tilting. Depression of scapula as well as anterior tilting of scapula. As the alignment of fibers is this way, it will cause depression as well as it will pull this bone in this manner, so that the upper part of scapula will tilt forwards, will cause anterior tilting. So anterior tilting and depression of scapula will occur because of this overactive latissimus dorsi, and which is because of the weak or inhibited opposite side gluteus maximus. Now, in order to balance this anterior tilting and depression of scapula caused by overactive latissimus dorsi, two muscles, trapezius, specifically the upper trapezius, as well as the levator scapulae, those two muscles will come into picture, will cause overactivity of those two muscles, that is the upper trapezius as well as the levator scapulae. So the upper trapezius has its attachment over the scapula, as well as the levator scapulae has the attachment to scapula. So both will cause elevation of scapula. Since we know that overactive latissimus dorsi is causing depression of scapula, to overcome that, trapezius, upper trapezius as well as levator scapulae will become overactive, which will cause dysfunction in shoulder region as well as the cervical region. As symptom, it may present as pain in cervical as well as shoulder region. So here we understood that weak or inhibited contralateral gluteus maximus can also give rise to shoulder as well as cervical pathologies. In people who are engaged in athletic activities such as runners, who require their gluteus maximus to be strong enough, if it is not, and they are performing the activity repeatedly, then it will cause overactivity of latissimus dorsi and will transfer the problem to cervical and shoulder region. But the actual root cause lies in weak or inhibited contralateral gluteus maximus. One more fact about latissimus dorsi, as it has its attachment to the inferior angle of scapula, can be appreciated in this diagram, and we already know it has its origin at the inferior angle of scapula. So it will assist the rhomboid as well as levator scapulae to depress, as the latissimus dorsi has its action to depress the scapula, and as well as downwardly rotate it. So it will help rhomboid and levator scapulae to depress as well as downwardly rotate the scapula. So we can appreciate the rhomboids, minor, major. So this will be levator scapulae and this is our rhomboids. So the latissimus dorsi, having its attachment over the inferior angle of scapula, will assist this levator scapulae the latissimus dorsi will assist this levator scapulae as well as the rhomboids in depressing as well as downwardly rotating the scapula.